Now, for the next discussion, we're trying to look at the management of severe malaria. So management of severe malaria is all about trying to pinpoint all the drugs that are very important in managing malaria. So once you say something is severe, just note this in general. Most of the times they switch the type of drugs they are giving from oral drugs to intravenous drugs, because severe, the patient is actually out and all of that, So most drugs you list in severe cases is usually intravenous. So severe malaria, you should know that it's an emergency. It's a medical emergency. So the cornerstone usually use intravenous drugs. You use supportive cares like you put the person on fluid, oxygen therapies, and blood transfusion if needed, because the malaria parasite usually breaks down the blood cells. So immediate antimalarial therapies, intravenous artesunate is the first line of drug for all ages. Children, pregnant women, intravenous artesunate. Okay, so if artesunate is unavailable, you go for alternatives like what? Intravenous artemether or intravenous quinine as alternatives. Okay, so once the patient is stable, you switch from intravenous drugs to the oral combinations. You understand? So supportive care, you put them on what? IV fluids, because most people are getting dehydrated. Then blood transfusion if a lot of blood cells have been broken down too much. Antipyretics just to control the fever. Anticonvulsant like diazepam, phenobarbital if you want to actually control the seizures. Oxygen therapy if the person is actually finding it difficult to breathe. Okay, then if the person is hypoglycemic, you put them on glucose. Okay, so that's what we got, right? So monitoring and complication is you are watching out for signs of cerebral malaria like coma and seizures. You are looking out for the kidneys, making sure that the kidney is still producing the adequate urine. Respiratory function, you are making sure that the person is okay in as much as they are trying to catch their breath and all of that. Then you try to correct the electrolyte imbalances. So that's what we have for the different drugs you use in managing severe malaria.